Hello, this is Dr. Gary from First Lake MRI, and this is a 34-year-old female who had back surgery about 2 months ago. Her symptoms did not resolve like they thought they should, so they did an MRI here to see what is going on. So this is a sagittal view looking in profile. This is towards the front, this is towards the back. This is called a T1 weighted view, where we see the discs, the shock absorbers here are intermediate. The vertebral bodies are bright, they have a lot of fat in them. The brightness here is subcutaneous fat, and fluid is dark. So you can see the dark band here. This is fluid in the spinal canal. Back here we see this dark band. This is where they had surgery. The incision is back here. Fat is bright, and here we see it's dark, so that's where they did the incision. This is another view called a T2 weighted view. In this view, fluid is white instead of dark. The discs are more bright, and we can see the nerves individually here, little strings like spaghetti coming down here, the nerves. And we can see the discs, nice disc spacing at each level. This is in back here where the subcutaneous fat is bright. Well, fluid is also bright. So on a view like this, we see that there is a problem in the back here. We see this darkness here, this is fluid, and this area of brightness here, this is fluid. So we have an abnormal fluid collection at the site of incision. And they did a laminectomy right over here at this L45 level. If we roll to the right hand side, we're going into the right. We're going to be able to see the right foramen, which is a hole where the nerve comes out. Normally we should see a dot, which is a nerve, and we see a big opening called the foramen. Over here we see the dot, the right L4 nerve, and we see a darkness here. This is the disc material. So at this point we don't know if this is a residual or recurrent disc herniation touching the nerve there, or if this is related to surgery. Sometimes when they do surgery, you can get granulation tissue, and it'll look just like a disc herniation. So we need to give contrast on this one to see, is this a residual or recurrent disc herniation, or is this just related to the surgery? If we go off into the right foramen, on this view we can see the nerve, that dot. We see the brightness surrounding it is fat, and we see this gray glob. And again, at this point we don't know if this is a disc herniation, where they didn't remove it all, or if this is just granulation tissue related to surgery that's going to resolve. And we're going to look at this fluid collection back here again. So now we're going to go to another view with contrast. Now this view is fat suppressed, all the fat is dark now, and enhancement, the contrast is very, very bright. So we see right here this little vertical band of brightness around the rim. The disc is dark, and we see this brightness around the rim. That brightness is the enhancing granulation tissue, so we can see that this is not a disc herniation, because the disc material would be dark. Instead we see it's bright, so this is granulation tissue called post-op granulation tissue related to that surgery. It's really prominent, and it can be very prominent soon after the surgery. On this view, this is an axial view. We're slicing through this. We see this thick rind over here. This is that enhancement around the disc margin, prominent granulation tissue. We also see enhancement going backwards through this bony defect. This is a laminectomy. This is a left lamina, a piece of bone that's normal, and this is where they remove the bone, the laminectomy, to give room over here. Again, they have just really prominent thick enhancement around the rim, and over time we hope this will go down. But there's one other finding they had, and this is in back here. You see this thick enhancement. The brightness is the enhancement. Fat is dark. Fluid is also dark in this. So we see this irregular fluid collection with prominent surrounding enhancement, and the question is, well, what is this? Is this a hematoma, which it could be with enhancement around the rim? Could this be post-op serous fluid? It's very common to have serous fluid pool, and then over time they will slowly resolve. Sometimes the hematoma or serous fluid collection may get infected, and it can turn into an abscess. And so at this point it's hard to tell for sure what this is. So we may mention all these. This could be a hematoma or post-op seroma, and the possibility of an abscess developing. We can't exclude that yet, and so they'll probably follow this up and treat them. They could put a needle into it at this point and just see, is it infected? But based on their clinical history, they may choose to aspirate it, or they may choose to just follow it or even give antibiotics. But this is, again, a right laminectomy with really prominent enhancing granulation tissue about the rim, and this fluid collection back here. They're probably contributing to their pain, and we're not exactly sure what it is, but we're giving them good information about where it is, and they can decide based on the clinical examination and other things if they think this is becoming infected or not. And that's it. Thank you so much.